Hello, this is Dr. Mark Hamilton, a facial plastic surgeon here in Indianapolis, and today we're talking about nasal aesthetics. Some of the things to think about when you're approaching your rhinoplasty consultation. So many patients come to me and they know that they don't like their nose, but they can't actually put words into what they want to communicate. So hopefully this will help a little bit. And today I have with me here Sophie, who doesn't need a rhinoplasty, but that makes her a good model to talk a little bit about nasal aesthetics. So one of the first things we do when we approach a patient is we look at the overall face and the nose in relation to the face as well as the skin. And like Sophie here, some people have a little bit thicker skin, which helps the advantage for the surgeon of camouflaging any little minor imperfections during the procedure, but sometimes this can limit the amount of definition that we get with surgery. On the flip side, somebody with very thin skin, we can usually achieve a little bit better tip definition, but we have to more worry about little imperfections. We also look at the nose from the front and how that fits into the balance of the face. And in general, when we look at the face from the front, we divide it horizontally into fifths, which each fifth being about the width of the eye. So we have our first fifth, second fifth, and then this fifth between the eyes is basically the width between of an eye, and it should fit in between a line vertically drawn from the corner of the eye, straight down. And Sophie's does that. If it's too wide in that area, we have procedures to narrow it. We also look at what we call the brow tip aesthetic line. And this is a line that gently curves from the brow along the side of the nose. You'll see a shadow in that area down to the tip. And we want this to be a very gentle, soft curve. If somebody has a nose that's wide in two areas and narrow in others, you'll see this be more jagged. Lastly, we look at the definition of the tip. And with this photographic lighting, you'll see that at the tip of Sophie's nose, there's two little points defining the tip. We don't want that to be a single point, but we want those 2 points to be fairly symmetric on the same plane and with just a little bit of distance between them. And that's what we call a nice aesthetic tip. Then going to the side of the nose, and we'll have Sophie look on the profile. This is what generally a lot of patients say they see a bump or hump that they want to correct. Ideally, what we want to see is a nice gentle curve, like we see in Sophie there. Almost sometimes a little concave in the feminine nose. In the male nose, we want this very straight and maybe even a little bit of a hump. And this goes all the way down to the tip, where you'll generally see this tip area of the nose project out maybe 1 or 2 millimeters from the dorsal profile. And that brings us to tip projection. Tip projection is how far this tip projects from the side of the face. And in general, we want this length from the very base of the nose out to the tip to be about 60% of the total length of the nose. And Sophie's fits in nicely with that. Lastly, we look at rotation of the nose, how far tilted up the nose is. And you can see Sophie has a gentle tilt up in here. In the feminine nose, we like this to be anywhere from 100 to 105 degrees, slightly tilted up. In the male nose, we want this to be more straight, more of a right angle, about 95 degrees. So this has been Dr. Mark Hamilton, and we've just been talking about some of the things we look at aesthetically with the nose when we approach a rhinoplasty consultation.